Hi, everybody, and welcome back to Diseases and Epidemiology with me, Sophia Jiang. And today we're going to be talking about core epidemiology functions. So all information is from the CDC. So yeah, let's get started. So there are 6 major tasks of epidemiology. And of course, when you're going into this, you're asking, how can epidemiology be used? And what is really the purpose of epidemiology? And in some of my previous lessons, we have touched on some of them, but here we're going to go more into depth into these major tasks. So I have them on the screen here. Number 1, public health surveillance. Number 2, field investigation. Number 3, analytical studies. 4, evaluation. 5, linkages. And 6, policy development. So let's get started with number 1, public health surveillance. So public health surveillance, it's defined as the ongoing systematic collection, analysis, interpretation, and dissemination of health data to help guide public health decision-making and action. It's also known as information for action because it is, number 1, it is the first thing that most epidemiologists are going to be looking at. So the purpose of public health surveillance is to portray the ongoing patterns of disease occurrence and disease potential. And they're going to get this information from morbidity and mortality reports. And it can be used so investigation, control, prevention measures, they can be applied effectively and efficiently. But first, before we go on, I'm going to talk about the difference between morbidity and mortality, because they are very similar words, but they do have their differences. And it's good to keep them separate when you're thinking about these terms. So morbidity, it's defined as any departure, subjective or objective, from a state of physiological or psychological well-being. So to sum it up, how many people get sick? So if you're looking at a morbidity report, you're asking what is the morbidity? You're asking how many people got the disease. Mortality, on the other hand, is the occurrence of death. So in this case, it would be how many people died. So back to public health surveillance. So we have this nice chart here on the right that shows basically the whole flow chart of how it works. So we start off with public and healthcare providers. These are our clinicians, laboratories, and hospitals, and they are the ones collecting the data. Once again, there's morbidity and mortality reports that was on the previous slide. Now, this data that is collected is reported to epidemiologists. So there are some diseases that I've listed here, pertussis and meningococcal meningitis, that these public and healthcare providers have to report whenever they get a case like this. So those two are just some examples. And then based on that data, feedback is given. So for example, if we have a particularly high number of this disease, then epidemiologists might say, give as feedback, say that, oh, these healthcare providers should be on the lookout for cases of this disease so they can get more information about it, and etc. So how it works is that now there are forms of electronic reporting. You just fill out a simple form, and it takes into account some information such as daily emergency department visits, sales of over-the-counter medications, worker absenteeism. And here's something to note: not every case of a disease is reported, but health officials regularly review the case reports that they do receive and look for patterns among them. We don't get everybody, but we are getting a sample of the population, which is just as good. Now moving on to second task, field investigation. So the purpose of field investigation is to investigate something in order to identify one of these three major things to identify. And those are unreported illnesses, sources, and case definitions. So as I mentioned before, not every case is reported. So sometimes you might need to go and get more data, and you might want to identify more cases that already exist but have not been reported. Here's an example. So identification of sexual partners or contacts of patients with STDs to prevent infection and provide treatments is especially important. And for sources, if you want to identify sources, that's really important because there you can stop like many additional cases that might result from it just by attacking it at the source. So for example, the identification of the vehicle of E. coli. It could be ground beef, or in rare cases, it's even fruit juice. So once this product is recalled, then we are preventing that many more cases. And identification of case definitions, it's basically that we're trying to identify more of the natural history, the clinical spectrum, and the risk factors that are associated with this disease. So I've used COVID-19 as an example, and when we know all this information, identified all this information, then we can use it to prevent more cases through appropriate isolation and quarantines. So a fun fact is that field investigations are sometimes referred to as shoe leather epidemiology because it brings up a picture in your mind of dedicated epidemiologists beating the pavement in search of additional clues and cases regarding source and mode of transmission. And I have that photo right there because that is exactly from the site of the EIS, which is the Epidemic Intelligence Service, which is the CDC's training program for disease detectives. So that's pretty interesting. Over here, we have the shoe with the hole in it. So moving on to our next task, analytical studies. Analytical studies are a bit more rigorous than field investigations are. While field investigations were just going out asking a few more questions, getting a little bit more data. Here in analytical studies, we are actually conducting an experiment. So surveillance and field investigations might provide clues or hypotheses about causes and modes of transmission. And the analytical studies evaluate the credibility of those hypotheses. So if you remember John Snow's cholera investigation, that is exactly what he did. You might be wondering, how did he get his hypothesis that the water wells were a source of cholera? Then you know that it was from surveillance and field investigations. So analytical studies, they use descriptive epidemiology. What it is, person, place, time. We're describing the person, place, and time. And from there, we can calculate the rates and identify parts of the population that might be at higher risk than others. And one important thing about an analytical study, because it is in real scientific experiment, it uses a valid comparison group. So this would be people who are not sick and people who are sick. You wouldn't want to use a comparison group that are like people who are a little bit sick and people who are very sick, because it's a bit harder to quantify how sick someone is rather than just say she is sick, she is not sick. So that would be a valid comparison group. And if you are maybe approached with like groups that are like kind of like a whole spectrum of maybe how severe is the disease, that wouldn't be necessarily valid unless you had really strict parameters defining each. So now we're going to move on into more of the design, the conduct, the analysis, and the interpretation of analytical studies. So the design, how it works, is that epidemiologists will determine the appropriate research strategy and study design. They will write justifications and protocols, calculate sample sizes, decide on criteria for subject selection, choosing an appropriate comparison group, and designing questionnaires. And all of this is before they actually do anything. So conduct, that's when they will secure appropriate clearances and approvals, adhere to appropriate ethical principles, abstracting records, tracking down and interviewing subjects, collecting and handling specimens, and managing the data. And then once they have the data, they will analyze it. They will describe the characteristics of the subjects, such as the calculations of rates, creations of comparative tables, and they will describe the computation of measures of association, test of significance, confidence intervals, all things that are involved in analytical epidemiology. And then finally, we get to the interpretation, is how we want to interpret this analysis, the data. And finally, it's like putting the study findings into perspective. You identify the key take-home messages, and you can make sound recommendations from the results of the study. So now moving on to evaluation. So evaluation is the process of determining as systematically and objectively as possible the relevance, effectiveness, efficiency, and impact of activities with respect to established goals, which focuses on plans, formative evaluation, operations, process evaluation, impact, summative evaluation, outcomes, or any combinations of these. It's basically just saying, how good is the system that we have in place? Or how good is the outcome? How good are our plans for it? Because you do have to evaluate each step on the way to improve the overall experience or the overall process. So just something to also keep in mind, the difference between effectiveness and efficiency, because it is defined very clearly in epidemiology and it cannot be used interchangeably. So effectiveness is the ability of a program to produce the intended or expected result in the field. And this is contrasted with efficacy, which is the ability to produce results under ideal conditions. So remember that effectiveness is in the field, which is like in the real world, and efficacy is under ideal conditions, for example, like lab conditions. And efficiency would be the ability of the program to produce the intended results with a minimum expenditure of time and resources. So going back to evaluation, I have some examples here. So you could evaluate an immunization program, and this program might assess the efficiency of the operations, like, are we minimizing the cost of the operation? We can assess the proportion of the target population immunized, assess the apparent impact of the program on the incidence of vaccine-presentable diseases. We can also evaluate a surveillance system, and some things that you might see in that sort of evaluation is the operations and attributes of the system. Is it working? Is it not working? Could it be better? We might address its ability to detect cases or outbreaks, and overall just its usefulness in general. And next, we have linkages, which is our fifth major task. So an epidemiologist usually participates as either a member or the leader of a multidisciplinary team. And because normally you can't do all of the stuff on your own. So you need the help of laboratorians, sanitarians, infection control personnel, nurses or other clinical staff, and computer information specialists. So how you would get these linkages or how you would sustain these linkages, because they are important to epidemiology, is you could have an official memoranda of understanding, could share published or online information for public health audiences and outside partners. And you can also do it through informal networking that takes place at professional meetings. So finally, we reach policy development. So epidemiology working in public health regularly provide their input, their testimony, and their recommendations regarding the next 3 bullet points: disease control strategies, reportable disease regulations, and healthcare policy. And epidemiologists are really important in this aspect because they are the ones who have analyzed the data, and they're the ones who understand the situation the best, so they can make good recommendations. Because if we go back to the definition of epidemiology, at the end it says right there, and the application of the study to the control of health problems. So this is really a major task of epidemiologists too. It's not just something you would pass on to someone else and have them do for you, because this really is an area of expertise for epidemiologists because of the other major tasks. So now we're going to go and do some review. So on the right, we have our 6 major tasks: public health surveillance, field investigation, analytical studies, evaluation, linkages, and policy development. And on the left, I have short little blurbs about like an example or like a use in action of these major tasks. So I'm going to read each out loud, and you guys can pause the video after I finish to try it on your own, but I will explain the answers after I give them. So the first one, reviewing reports of test results for chlamydia trachomatis from public health clinics. This would be A, public health surveillance, because you are looking at reports from public health clinics. If you remember the cycle before with the healthcare people reporting and all that, this is where epidemiologists get their information, public health clinics. So this would be surveillance. Meeting with family planning clinics and college health clinics to discuss chlamydia testing and reporting. That would be E, because it is, once again, this whole linkage thing. They're meeting with the family planning clinics, which might be a member of their team, and college health clinics to discuss this. And once again, sustaining linkages, it's all about sharing information. And this is what they're doing, discussing testing and reporting. Nothing's being investigated, no policy is being implemented. They're just discussing and sustaining their linkages. Next, we have developing guidelines about which patients coming to the clinic should be screened for chlamydia infection. So keyword here, developing, would be F, policy development, because of course we're developing a new policy. So maybe to help surveillance, maybe to help reduce the number of cases, so on and so forth. Next, interviewing persons infected with chlamydia to identify their sex partners. Well, that would be B, field investigation. It's very similar to the other example that we had before about identifying unreported illnesses. So, and once again, this is field investigations, not analytical studies, because analytical studies, you would need a comparison group, and here it's just interviewing people. Next, conducting an analysis of patient flow at a clinic to determine waiting times for clinic patients. So this one would be the evaluation, because we are doing an analysis of patient flow to determine waiting times for clinic patients. So we would be evaluating the effectiveness, the efficiency of the clinic. And they're doing it by looking at waiting times for the patients. And finally, we have comparing persons with symptomatic versus asymptomatic chlamydia to identify predictors. Here we do have our clear comparison group, and it is valid. People that are symptomatic, people that are asymptomatic, very two different things, because you can't be both symptomatic and it's asymptomatic at the same time. So it is a very good comparison group, and it would be C, an analytical study. So that brings us to the end of our lesson today, core epidemiology functions. So thank you for listening, subscribe, visit our website and all that. So I'll see you guys next time. Bye.